Welcome to the course on mental health care. The World Health Organization, or WHO, states there is no health without mental health. People with poor mental health are more prone to developing other chronic conditions. Further, diagnosis and treatment for a chronic condition that is non-psychological in nature often take a toll on one's mental well-being, which can worsen health outcomes. Consider, for example, that depression is 2 to 3 times more common in people living with diabetes. Among people with CVD, 20% were found to suffer from depression, and a severe mental disorder has been shown to triple the risk of an extended hospital stay for an acute cardiac event. 25% of cancer patients have been found to suffer from anxiety, depression, or both, which diminishes their quality of life and adherence to treatment plans and increases hospital stays and risk of suicide. Because of these associations, the WHO stated in 2017 that mental health should be a central component of primary care services. This course seeks to improve integration by raising awareness of major mental disorders and imparting clinical strategies in areas such as screening and diagnosis, among others, that primary care providers can employ in daily practice. The program has 6 lessons, which can be taken in any order. However, we recommend you take the Introduction to Mental Disorders lesson as a precursor to any other lesson in the curriculum. The lesson, Introduction to Mental Health Disorders, covers foundational concepts to prepare you for a deep dive into individual mental health disorders in the later lessons. Did you know major depressive disorders, or MDDs, are the most common treatable mental disorders worldwide? Learn about the consequences of MDDs and how to safeguard patients in this lesson. The lesson, Unhealthy Substance Use and Related Disorders, tackles the harmful use of alcohol, drugs, and tobacco. Learn the drivers, signs, and side effects of substance use and how to counsel patients struggling with addiction. For the next lesson, we'll cover the topic of sexual dysfunctions. Learn how sexual problems can be psychological rather than physiological in origin, and how to destigmatize conversations about sexuality and gender with patients. The lesson, Memory Disorders, explains the presentations of different types of dementia, how to distinguish the disease from age-related memory impairment, and how to mitigate cognitive decline in patients. In the lesson, Trauma and Stressor-Related Disorders, learn to provide psychological first aid to trauma victims and reduce their risk of slipping into post-traumatic stress disorder, PTSD.